इस पैंडेमिक ने हमें ये तो रियलाइज करवा दिया कि कितनी बड़ी पॉपुलेशन प्रॉब्लम है इंडिया की। और अगर देखा जाए तो सबसे ज्यादा केसेस वहीं से आए हैं जहाँ पॉपुलेशन डेंसिटी बहुत ज्यादा है, जैसे दिल्ली, मुंबई, अहमदाबाद, इंदौर और जयपुर। और मुंबई के धारावी ने ये दिखा दिया कि मैनेजिंग अ पैंडेमिक इन एन ओवरक्राउडेड स्लम कैन बी अ नाइटमेयर। This is how severe our population problem is. We have 16% of the world's population with only 2.45% of the world's land and only 4% of water resources. तो no doubt हमारे natural resources और infrastructure पर बहुत ज़्यादा stress पड़ रहा है. But guess what? There is an interesting fact. अभी हमारा fertility rate, मतलब कि the average number of children a woman must have to keep the population under control, 2.2% है, which is almost at par with most of the Western nations. 1950s और 60s में तो हमारा fertility rate 5 और 6% के करीब था. No wonder हमारे दादी के 6 या 7 से नीचे बच्चे ही नहीं होते थे। तो टेक्निकली हमारी पॉपुलेशन ग्रोथ कम हो रही है, मगर हमारा बैकलॉग ही इतना है कि हमें बहुत साल लग जाएंगे ऑन ट्रैक आने में। एक्चुअली हमारी पॉपुलेशन प्रॉब्लम इजंट समथिंग न्यू। इट वाज अ कंसर्न बैक इन द 50s एंड द 60s आल्सो। तभी तो हम दो, हमारे दो, छोटा परिवार, सुखी परिवार जैसे फैमिली प्लानिंग प्रोग्राम्स चालू हुए थे। इमरजेंसी के टाइम हमने लाखों की नसबंदी करवा दी थी। एवरीवन नोज हाउ दैट वेंट। उसके बाद से नो अदर पॉलिटिशियन हैज एवर टेकन इट अप अंटिल रिसेंटली व्हेन प्राइम मिनिस्टर मोदी इक्वेटेड स्मॉलर फैमिलीज टू एक्ट ऑफ पेट्रियोटिज्म। ये तो अलग लेवल का सोल्यूशन दे दिया। Now there is a clear communal subtext to this issue. बहुत पॉपुलर परसेप्शन है कि मुस्लिम ज्यादा बच्चे पैदा करते हैं as compared to Hindus, और अगर इसी रेट से चलते रहे they'll outnumber the Hindus very soon. This is not entirely true. The Muslim fertility is falling faster than Hindu fertility, and the gap between the fertility rates of the two communities is closing in faster. This is what the recent National Family Health Survey shows. See, I'm not going to get into the politics of it, but what I mean to say is that we've been trying to control our population through our national population policy, which gives everyone the right to choose their family size because we're a democracy and that's a good thing. So I want to talk about the possible solutions to our population problem. The first popular solution is the two-child policy. Sounds very practical, right? Already 12 states ने two-child policy को sort of implement कर लिया है. For example, Assam government ने decide किया है कि जिनके 2 से ज्यादा बच्चे होंगे उनको government jobs नहीं मिलेंगी 2021 से. तेलंगाना, आंध्र प्रदेश, बिहार, उत्तराखंड, महाराष्ट्र, राजस्थान एंड गुजरात do not allow people with more than 2 children to contest local, municipal and पंचायत elections. महाराष्ट्र में एक और रूल है कि जिन औरतों के 2 से ज्यादा बच्चे होंगे उनको पीडीएस बेनिफिट्स ही नहीं मिलेंगे. So has all of this worked? Not really. There's actually another model which is delivered. Kerala has none of the restrictions and yet their fertility rate is far lower. Education, healthcare and the choice of contraceptives have done the trick for the entire state. And to support the two-child policy, we always give China's example that how with their one-child policy they were able to lift their economy and their people. मगर अभी उसका खमियाजा वो भुगत रहे हैं because they're a very aged nation और अपनी younger population को on track लाने के लिए उन्हें बहुत decades लग जाएंगे. So maybe we should rethink our two-child policy fascination. This brings me to my second solution, women. Women with no schooling on an average have more than 3 children as compared to 2 children for women with more than 10 years of schooling. The number of children per woman declines with her level of schooling. And of course, Kerala has done so much better because 77% of their women have attended school for 10 years or more. वहीं बिहार में सिर्फ 22% women और उत्तर प्रदेश में 32% women have attended school for more than 10 years. See, as women get more literate and they have better status in society and better access to contraceptive measures, they opt to have fewer children. And men as well prefer to have smaller families when they get more educated. You know, this can also help in reducing our preference for the male child as well because a lot of women are forced to have several girls before the desired son arrives. So the mantra is simple. Empower the women and they'll diffuse the population bomb. And now the third solution. Providing affordable and accessible medical care and reducing maternal and infant mortality. See, we need to have a cafeteria kind of approach when it comes to contraception. मतलब कि reversible और irreversible contraception के बारे में individuals को और couples को पता होना चाहिए so that they can decide what they want to go for. तो इसको successful करने के लिए हमारे public health centers को बहुत robustly काम करना पड़ेगा along with providing the right kind of medical attention which they're not being able to do so because of lack of funds. See, we were an unplanned nation and a lot of things happen haphazardly or are taken for granted in our country. मगर इस कोरोना वायरस पैंडेमिक ने हमारी population problem को आंखों के सामने ला दिया है जिसको हम अनदेखा नहीं कर सकते अब. So let's make sure that as responsible citizens we're asking the right questions to the government क्योंकि अगर दोबारा कुछ ऐसा हुआ ना तो हम handle नहीं कर पाएंगे. Yes, I'm thinking aloud, but what do you think? Tell me in the comments below, and if you like this video then share it and subscribe to India Times.